This is a PSA for hepatitis A by Connor, Drew, James, and Keenan. Hepatitis A is a disease that affects the liver, and it is caused by a virus called hepatitis A virus, or HAV. This virus is an RNA virus, which means it carries its genetic material as RNA. It belongs to a virus called picornaviridae. Even though it's a small virus, it can cause big problems if someone gets infected. Hepatitis A is usually spread through something called the fecal-oral route. This means people get it by eating or drinking things that are contaminated with tiny amounts of infected stool. It can spread from person to person, especially when people don't have good hygiene. Traveling to countries where hepatitis A is common is another risk. The best way to prevent it are good hand washing, clean drinking water, and vaccines. Here's a diagram showing the fecal-oral route. It may look basic at first, but as you follow things through, you can see how everything is connected. I'll give you guys a few seconds to do that.
So hepatitis A can cause many various side effects. It depends on the severity. So fatigue and nausea are very common, as to be expected. Vomiting as well. A loss of appetite and mild fever should also be expected. And additional symptoms can be liver pain and dark urine, since the liver is affected. In adult patients, they are more likely to have a yellowing of the skin and eyes, which is known as jaundice. And hepatitis A can also cause joint pain, but that is much less common than all the other side effects. So for the long-term health consequences, despite all the symptoms that come with hepatitis A, nearly all the patients that ever get infected with it will recover. So severe complications are rare, only happening in mostly elderly people or people with already existing liver issues. It's definitely not chronic, unlike hepatitis B or C. And then people infected with hepatitis A become immune for life, and they do not have any long-term health consequences.
Hepatitis A is actually very preventable if people take the right steps. The most effective tool we have is the hepatitis A vaccine. It's highly effective and especially important for young children and people traveling to high-risk areas. Another key way to prevent it is through good hygiene, especially through proper hand washing. Since hepatitis A spreads through contaminated food or water, making sure food is handled safely is also critical. If someone has already been exposed, they can still get protection by getting the vaccine or immune globulin within 2 weeks. That's called the post-exposure prophylaxis, and it can prevent the virus from causing illness. Unlike many diseases, hepatitis A doesn't require medication to cure. There's no specific antiviral treatment for it. The body clears the virus on its own. Doctors usually recommend supportive care like resting at home, drinking plenty of fluids, and eating small, light meals. It's also important to avoid alcohol and drugs so the liver isn't under more stress. The good news is that hepatitis A is self-limiting, which means it goes away on its own over time. Most people completely recover without long-term effects. And these are our cited sources. Thanks for watching. Wash your hands.